Great, I see everybody entering the space. Give it about another minute. Good afternoon. My name is Jasmine King, and I serve as the Director for the Center of Racial and Gender Equity with YWCA Lancaster. To begin this event, I would like to recognize each respective YWCA organization participating and their native land as a step to acknowledge the true stewards of the land we serve. Susquehannock, Lenape, Shawandasa, Tula, Osage. Community Now discussion started at YWCA Lancaster in the spring of 2021. As a way to connect with community members with vital information. These discussions look at the inequities that exist in systems with deep curiosity to ultimately dismantle racism in our respective spheres of influence and beyond. I'm thrilled to introduce our moderator for today, Diane Hightower. Diane Hightower is very involved in community service as demonstrated by her volunteer service at her local YWCA Westmoreland County as a board member for a decade, where she has served as chair and the People's Library Board, where she currently serves as vice president. Ms. Hightower also serves as a member of the Westmoreland County Community Action Staff and developed a GED curriculum for grant-supported programming in Jeanette and Derry School District, as well as managed volunteer income tax assistance programs. In 2017, she joined the Carlow University as an adjunct faculty member in the Masters of Student Affairs graduate program, and in 2019 was appointed a fellow and later director of academic support programs. It is my esteemed and distinguished and privileged to introduce Diane Hightower, our moderator today. Diane?
Thank you so much, Jasmine. I have so much been looking forward to this afternoon's discussion because of its relevance and relationship to the mission and purpose of the Community Now webinar series, a community engaged forum. I welcome you to this afternoon's conversation and promise an hour of healing, of connecting, and of co-creating justice-focused solutions to our region's toughest challenges. So let's just get started. Being Black is bad for your health, and pervasive racism is the cause. That's the conclusion of multiple public health studies over more than 3 decades. Dr. Georges Benjamin stated, "We do know that health inequities at their very core are due to racism. There is no doubt about that." But he goes on to say that more recently, research has shown that racial health disparities don't just affect poor African Americans, but they also cross color lines. This afternoon, not only will we take a look at data and research, we will also discuss the varied intersections of racism and public health. And most importantly, begin addressing the crisis and work towards healthier, more equitable communities through the eyes of our distinguished panelists and the families that they represent. More specifically, this panel accepts 4 basic premises. First, racism is a public health crisis. Second, systematic and structural racism exists. Third, many of the racial and ethnic disparities that have particularly negatively impacted the women we serve at our collective YWCAs result from systematic and structural racism. Next, to achieve racial equity and community connectedness, we must address the effects of racism. What does our research tell us? At the individual level, discrimination and racism lead to negative health outcomes. At a community level, racism impacts access to opportunity and shapes the context in which we work, live, and interact. The 2021 Pennsylvania County Health Findings Report provides a wealth of information, but in two very significant sections, we find that the low birth weight for Blacks and Hispanics is much higher than the white counterparts, and that clinical care in the areas of preventable hospital stays, mammograph screenings, and flu vaccinations is significantly different between these three populations, with clinical care provided for white communities performing in a much more favorable manner. Access to quality housing, education, transportation, food, healthcare, public safety, work opportunities, civic engagement, and other areas are impacted by historically rooted systematic barriers. And then finally, in Pennsylvania, there have been 4 declarations made in different parts of the state: Allegheny County Council, Erie County Council, Philadelphia Board of Health, and the Pittsburgh City Council. However, declarations are not absolute solutions, but instead are opportunities for action that can drive meaningful change. Declarations are the important first step to advancing racial equity and justice, and must be followed by allocation of resources and, most importantly, strategic action. This afternoon, we are honored to have 4 panelists who will address this issue, discuss the research, explore the needed critical change, and share more about the strategies used by nonprofits who are already working and making progress, impacting this public crisis through action and advocacy. Let me please introduce Jean Treuthart, the Chief Executive Officer for the YWCA York; Stacie Blake, the Chief Executive Officer for the YWCA Lancaster; Angela Reynolds, the Chief Executive Officer for the YWCA Greater Pittsburgh; and Stacey Woodland, the Chief Executive Officer for the YWCA Tri-County area. So let's get started with an opening question. And I pose this to all of our panelists, asking that you just take a couple minutes. We have a lot to get through in the next hour with respect to your response. To our panelists, it has been written by a number of academics, public health officials, and researchers that racism is killing Black Americans by propelling adverse socioeconomic conditions that contribute to serious health issues. Could you each take a couple of minutes and answer this? What does it mean that racism is a public health crisis? What does it mean that racism is a public health crisis? And Stacey Woodland, I'll ask you to get us started, please.
Thank you so much. And it's so wonderful to be here. And I think what it means that racism is a public health crisis is that we are looking at the health disparities that impact Black Americans, poor Americans across this country, and really understand how the critical issues of racism and discrimination create more opportunities for them to do more poorly than their white counterparts. I mean, I think there are 5 critical issues. And I think you talked about them a little bit, Diane, but housing, health disparities, educational disparities, wealth creation, and the criminal justice system are the things that are most impacting Black families from being able to be as equitable in how they live as white families. And I think that the first step is the acknowledgement, the acceptance, and the movement to action for the fact that racism is a public health crisis.
Thank you, Stacey. Angela, could you answer the same question for us? What does it mean that racism is a public health crisis?
Yes, thank you not only for the opportunity to be on this great panel, so a shout out to the sister YWCA associations, but coming off of Stacey's comment, one of the critical aspects of declaring racism as a public health crisis is that, 1, it addresses the individual within the collective and the impact of the collective on the individual. And what I mean by that is that when we think about the historical basis of systemic racism and how it has played out in our nation, we can also then see that in terms of patterns of communities, what that means in terms of access. And so many people then just take it to the community level and leave it there. However, those community impacts then impact families, which then impact individuals. And so one of the things you referenced this, Diane, in your opening comments, is that there are many times people just talk about higher rates of hypertension, or they talk about higher rates of heart disease, or talk about higher rates of high blood pressure within communities of color, particularly Black communities. There's research that shows that discrimination actually does lead to higher incidences of hypertension. So when we think about what that means historically as a basis, you can't just then say, okay, well, let's just blame the individual for choices. No, there are systemic patterns and there are policies and practices that lead to deleterious types of outcomes for certain populations. So understanding that impact of the collective on the individual. And then finally, when I talk about, understanding the community context and the individual as well, that when we start to recognize the role of racism and what that means for our public health, then we also start to recognize that it's not an individual's role to fix the issue, that we as a society have to come together and to address it. So that's what racism as a public health crisis means to me. It plays out with individuals, it comes up to the community, but we as a society are suffering because of it.
Thank you, Angela. Jean, can you give us your thoughts on this particular question, please?
Sure. Well, and thank you. And I want to welcome everyone. We're really pleased with the turnout, and this is also being recorded, so you'll be able to share it with your own circles. We know that there are racial disparities of health among communities of color. And for a long time, this was pinned on economic status and education levels. But that's only part of the story. Angela mentioned this a little bit too, because at every level of education, whites live longer than their Black counterparts. And the gap is actually the largest among college graduates. So what explains this? You really need to examine discrimination and racism and how they create stress and trauma. You are treated less courteously than others. You receive poorer service in stores and restaurants. You're mocked if English isn't your primary language. People act as if they are afraid of you. It comes down to dignity, respect, and being valued. Very recently, I just read an interview with Amy Sherrill. I don't know if you're familiar with the name, but you probably know her work. She painted this incredible official portrait of Michelle Obama. And Ms. Sherrill was discussing how one of the first things she did when she started to earn a little money was take her mother on a trip to Barbados. In that country, positions of power are held by people who look like her. Surrounded by Black people, in her words, running everything around me, was this eye-opening experience for her. She noticed that she felt psychologically more relaxed. Then flying back into Boston, she had to brace herself for the return to the weight of daily racism. This was eye-opening for her. Higher levels of discrimination, as Angela mentioned, are associated with a broad range of diseases and illnesses. And the National Academy of Medicine found that racial minorities do receive poorer health care from their most simple interactions in a doctor's office to some of the most technologically advanced treatments. It could be implicit bias that causes people to treat groups differently, even among the most well-intentioned individuals who would never see themselves as being racist. So if you take the impact of trauma that a lot of us have experienced in our lives, and then you add to that overlay of trauma caused by racism, you begin to see why this is a crisis. It's a national issue that needs immediate attention.
Thank you, Jean. We have quite a bit of conversation going on in the chat, Stacie Blake. People really giving and sharing their individual thoughts and feelings about this particular question. But again, to you, please give us your comments about the question.
Thanks so much, Diane, and hi, friends. I'm speaking to you from Lancaster County, and this is a place where we can clearly see disparate outcomes among the populations here with regard to economics, health, education, etc. For us to have poor outcomes on health that impact the marginalized Black and Brown communities the most makes us wonder about the systems. Here's what I learned. Here in Lancaster County, we rank 4th worst among the 67 Pennsylvania counties for the rate of children with elevated blood lead levels. 18.3% of children under the age of 6 who resided in previously red-lined census tracts had elevated blood levels when tested, lead blood levels. Our air quality is 15th worst in the country, as ranked by the American Lung Association. And yet, of the 7 largest counties in Pennsylvania, we are the only one without a public health department or any plans to create one. We're highly impacted by the pandemic here. In fact, our hospitals just yesterday and today had to stop elective surgeries because of the number of COVID patients that they are caring for, and only about half our county is vaccinated. So without a public health department, we do not have access to timely, specific health data about any of our population. And just a couple weeks ago, one of our county commissioners, we only have 3, said very clearly, he will not vote to study, much less establish, a county health department. This is an example of racism contributing to a public health crisis.
Thank you, Stacie. What a powerful way to start our conversation. And I'd like to suggest that we explore a couple other more specific questions. And Angela, we're going to start with you. Angela, as a champion for using a racial justice lens to shape the many programs and services offered within the community that you serve at the YWCA Greater Pittsburgh. And you also have been quoted as declaring the importance of making sure that all voices sit at the table for change, from grassroots organization directors to corporate CEOs to foundation executive directors. How is it possible that change can be made after all of the dismal and discouraging statistics that we've heard just now and we've received in the past? So I asked you this question, Angela. Why is declaring racism a public health crisis at a legislative level? Why is that so meaningful? And is it necessary?
So I'm going to answer the second one first. Yes, it's necessary. Now, why is it then important? And I also, as I'm addressing this, I also want to address some of the other comments that you made in the introduction to the question. It's important, going back to what you said in the intro, by declaring racism as a public health crisis, it prioritizes it. And then when we prioritize, we then need to put resources towards addressing it. That is critical. And I agree with you. Declaration is just one step in the process, but let's get that declaration so that we can then actually get on record, that we have our legislators on record saying that we recognize that racism is a public health crisis, and now we're going to enact policies to address and to fix it. And so I want to go back to one of the other comments that you were making, that as we bring this racial justice lens, we at YWCA Greater Pittsburgh, we are, and all of our YWCAs are eliminating racism, empowering women. At YWCA Greater Pittsburgh, we are focused on that intersection of race and gender. So those who are watching, Diane and I sit in the same general area. So we're in the Pittsburgh region. The City of Pittsburgh Gender Equity Commission released a report that addressed conditions in Pittsburgh, particularly for minorities, but then looking at Black women. So many of us talk about, gender and pay equity, and we say, okay, well, it's 82 cents for white women, 82 cents on the dollar for a white male. And then we know that those rates differ by race. So nationally, we're looking at 63 cents for Black women. So already we're looking at the historical practices of racism and how they're playing out in terms of the wage gap. And so you intersect race and gender, you have that issue. Where we sit in Pittsburgh is closer to 54 cents for Black women. That's not okay. And Black women in our area are more likely to live in poverty. And we also have high rates of maternal death. And I know that we see this across other places and other sectors. But when we think about this issue of like, why do we need to declare it? Because it's time for these disparities to end and to stop. And so, yes, you know, is it possible to make change? Yes, it's possible to make change. There are some, you know, pretty easy things that can be done, and there are some really hard things that can be done, but let's come together and start to do them. So if we understand that there are historical rates of inequities in pay, then stop asking for a woman's pay history. Because all you're going to do is just perpetuate those rates. Just take it off. You know what you're going to pay for the job. You know what the job pays? Pay women what it pays, and then make sure that we're being paid equally. And so when we understand and address the aspect of race and racism, and we need to say it, it's not just about race, it's also about racism, then how do we then go and start to look at those policies and practices and begin to hold people accountable? So I know that I have a limited amount of time to speak, but that was just one factor. And I want to just bring up one from a personal perspective. My 81-year-old mother is a breast cancer survivor. And because of that condition, I have a higher incidence and risk of breast cancer. But I also look at the research that says, even though Black and white women are diagnosed at the same rates, Black women are more likely to die. So we need to really start addressing, what this means in terms of racism and not just for women, but also how that impacts children and what that means moving forward as a society.
Thank you, Angela. Stacie Blake, you have written extensively about the significance of immigration laws that ended the national origin quotas we witnessed during the 19th century. But here we are in the 21st century, and I've got to ask you this: is eliminating racism even possible?
Thank you, Diane, for that one. I'm an optimist, so I want to say yes. I'm also a realist, and that makes me say I don't know, because people who are smarter, stronger, and more determined have worked harder and longer on this than me. And still here we are, despite all of those efforts to date. And here's the other thing. As we work on this, none of us know what it will look like when we get there. None of us have lived in the space without racism. So what do we know? We've been taught racism and racist ways. We have been raised in institutions that are designed to benefit whiteness. The teaching and that design can therefore be undone. We also know that the concept of race is not a fact. Racism is real, but race is the child of racism, not the father, as Ta-Nehisi Coates reminds us. Race was created to uphold unequal treatment, and that is something that we can stop. Won't it take time? One of our foremothers, Dorothy Height, said, if the time isn't right, you have to ripen the time. Society and culture are changing at a rapid pace. This pandemic has expanded and contracted time for all of us in unimaginable ways. And it leaves me with two thoughts that are true at the same time. We can't wait, and it's going to take a little time. What might be impeding our process, Diane, is not that people can't change, because we know they can. We have each seen people change, each of us. but people may not know how they fit into the structure and the imperative that they need to take action to change now. And that's why it's on all of us all day, every day.
Absolutely. Thank you so much, Stacie. Jean, about 4 years ago, along with several other YWCA leaders from Central Pennsylvania, you authored a public message about the violence that erupted in Virginia during a Nationalists Unite the Right march. And here's some of the couple excerpts from that particular document. Pennsylvania is no exception to the string of violent incidents that have permeated our nation. According to the Southern Poverty Law Center, the Commonwealth is home to 40 active hate groups. And remember, this was written in 2017. We must be vocal and not cowed into silence. We must listen to members of the marginalized communities and address bias, discrimination, prejudice, and racism every day. Together, we must be unflinching in our rejection of bigotry and injustice. 4 years later, Jean, what are some ways nonprofits are already making a difference in terms of eliminating racism?
Yes, that excerpt is from a letter written by collectively regional YWCAs to give voice to what was happening at that time. It would be interesting to see how many hate groups there are active now. But at RYW, we see our racial equity work through this continuum of awareness, education, advocacy, and activism. And you go through these stages to be fully prepared to be an activist. And my definition of an activist is someone who's working for social change, someone who's really committed. Now, activist has been co-opted to mean something negative by some, but I think we should all be an activist for something. There are nonprofits like the YWs, 200 strong from coast to coast, the NAACP, Learning for Justice, the Urban Leagues, Aspen Institute, etc., for which this is a significant part of their missions, and they are often operating at that advocacy and activism level. Each nonprofit has their own lane: housing, voting, voting rights, gender violence, like YW's, mass incarceration, gun violence, education, racial profiling, economic equity. We could go on and on. And I believe that they are having a real impact. Could we all use more funding for our work? Of course, but the work is happening. What I'm seeing over the last 2 years are more nonprofits who do not have this at the core of their mission, willing to put racial justice on their agendas. Maybe starting at that awareness level, they're bringing in implicit bias and anti-racism trainings for their staff and their boards. They're putting out some social media posts to educate other people. They're taking a stand. And I want to highlight the United Way of York County and their partner agencies, of which we are one, for embracing equity and heightening their efforts through their strategic planning process. We've seen a number of nonprofits who've launched DEI committees. The Rotary Club of York did this, which was wonderful and really exciting. And this Rotary Club and the Uptown Rotary Club in York both held courageous conversations on race with their members. So we're also starting to see more nonprofits that are really looking at their employee and operational handbooks through this DEI lens, this equity lens. They're creating internal equity plans to look deeply at white dominant cultures that they may have created. They're surveying stakeholders and they are self-educating. And to me, I'm seeing many, many nonprofits that are doing this with intention and not just checking the box. So then all of this can come together and it impacts how the nonprofits deliver their programs and services because their staff becomes more aware of their own biases and how their processes may be discriminating. And then BIPOC staff, Black, Indigenous, people of color, begin to feel more supported and invited to the decision-making table. Power is being shared. And I saw this evolution firsthand with a nonprofit health system in Central PA. And they went from asking a lot of questions about how best to serve vulnerable populations to then broadly exploring social determinants of health and then developing and implementing system-wide strategies. And it happened over 2 years, which is really quite impressive. They conducted follow-up surveys by phone and in person to ask their patients, people of color and staff of color, about their experiences, and they learned a lot. Some of the experiences were stories of poor service or being treated discourteously or ignored. Sometimes doctors or practitioners were thinking that they were being malingering, when actually the issue had more to do with their ability to purchase medication or find healthy foods, lack of transportation. And this healthcare system used the experience to make systemic changes, which was really incredible. We did see a national reckoning following the murder of George Floyd. And then what often happens is that businesses, people, nonprofits, they'll step up for a certain period only to stand still, or sometimes they take a step back later on. So think about the public show of support for Black Lives Matter. I mean, how many of those signs and statements are still out there? I would suggest that when these situations of violence happen, that is the time to push forward, even in the middle of our grief and our anger, so that after a period of time, if your organization, nonprofit or for-profit, does stand still for a while, you are definitely further ahead than when you started. So I see that change happens slowly, but I see the nonprofit sector very willing to be in that fight for equity.
Thank you so much, Jean. Stacey Woodland.
Present.
I know we had a little bit of a freeze situation going on, but I understand that we've worked it out. So
Yes,
I'm
ma'am.
so glad. Stacey, you have openly commented on the declaration of racism as a public health crisis. The data is clear and has been for years. In Pennsylvania, for example, health disparities in Black and Brown communities vastly differ, as we've heard several times in the last few minutes, from experiences noted in compared to predominantly white communities. COVID-19 exposed this reality. And also more recently, during some of your talks and interviews, when you have focused on the pandemic, you have shared the importance of stepping into these gaps. What are the most critical changes, Stacey, that need to occur first to address racism in public and community health?
So thank you for that question. Before I answer your question, I want to kind of bring together all of the answers of the questions that my sisters just talked about, because
Absolutely.
I think that there's this opportunity for vigilance that we talked about, the opportunity to be unflinching in what we know are our calls to action. And so I think the declaration of racism as a public health crisis is the first part, like Angela talked about. And it gives us the opportunity to really start to think about what are the next pieces and how do we take those steps. I think when you ask Stacie Blake about, is the elimination of racism even possible? My answer to that question is, I think we can eliminate systemic racism. I think that we can pull apart and dismantle the systems that are holding racism in place. I think we're, a lot of years away from maybe impacting how every single person thinks and acts towards people of color. But I think that we are far on our way to pulling the linchpins out of the systems that keep the health disparities and the systems and institutions of racism in place. And those are the most important parts of making sure that we can all have the same health outcomes and life outcomes that our white sisters and brothers have. And I think when we think about like those first steps, some of them have already been taken, just like Jean talked about. The Black Lives Matter movement, I like to call it the national awakening in the wake of the murder of George Floyd. And so that energy and effort is real, it's palpable, it is moving the needle on a lot of the work that needs to be done, and it is illuminating all of the places where racism is rooted. And I think as YWs and all the other wonderful nonprofit organizations that Jean talked about, I think that our education is showing us every day places where racism is still alive and well. And so, and we have to accept and embrace our roles when they rear its ugly face, to say, oh my gosh, I have to do something about that. So I think that, you know, there are communities who have already declared racism as a public health crisis, and they are in the design and build phase. And we really need to be making sure that the communities that have not done that yet get to that acknowledgement, acceptance, and action phase first. And then we can really start to think about all of the places that make the most sense for us to get at what is holding us back. One of the things that, you know, a lot of people have really been talking about the Great Resignation and how, you know, we have this labor shortage. And I was in a workshop that was really talking about that, and people, employers were saying, you know, I have good jobs and I can't fill the jobs. And we were pushed to really think about, so you might think you have a good job, but do you have a good job? And really gave checklists for what really makes a good job, right? And really talking about access to flexible schedules and just all those things. And in recognition that YWs especially have a lot of programs under their umbrellas that don't allow for some of the things that make a good job a good job. However, what really made me sit up and take notice was the fact that they started talking about unskilled labor and the industries that fall into the unskilled labor market, and how that term unskilled labor really came about in the 20s and 30s to protect jobs that white men wanted. And so now we have industries that are, a lot of them under YW umbrellas, early education being a key one, that is listed in unskilled labor and continually is underpaid and underfunded and under-resourced, really, because it goes right back to that 1920s and 1930s really moniker that got slapped on early education because white men didn't want to do it. And so for me, what I realized for my YW is that I have to start making sure that I am paying early education center teachers a living wage, and make sure that there is a pathway for them to be in salaried positions, in positions that they love, when they love building relationships with children and educating children, that they don't have to move out of the early education classroom in order to really be able to feed their families. Because I recognized in that moment when we talked about that we were holding in place that systemic and institution racism, because we've continued to call our early education system part of and fuel it and resource it as an unskilled labor. So that for me was so eye-opening. And I think that as YWs, we all get introduced to pieces of the systems of racism that we are really unaware that we've been perpetuating. And our charge is to take that information and as swiftly as possible make change. So I think that there are many conversations that we wouldn't be having if people weren't talking about racism as a public health crisis. And I think we have to just learn every bit of information that we can from every one of those conversations and actionize and make them actionable steps.
Thank you so much, Stacie. Before we, Gina, I'm going to ask you another question, but I'm also, again, checking the chat and thinking very seriously about how, as you pointed out, Stacie, all of these questions, reactions, responses are certainly very much connected to one another. Deanna, if I can ask you to make certain also that we place the email addresses for each one of the YWCAs in our chat, because I can see by the back and forth and the want to have more discussion, we might not have enough time in this hour, but certainly some of this can continue.
The participants will be getting an email from us and how to reach us and everything.
Very good. Thank you so much, Deanna. Jean, if I can just ask you a quick question before we talk about action steps. Before we move to some of our concrete action steps, I wanted to ask you about a concrete example of the need for change. Central York County districts ban or freeze on select anti-racism books and educational resources about people of color is something that I'd like to talk about for just a few minutes. Given that the district is in your coverage area, Jean, would you please speak to the public health impact of that decision and the delay in rescinding the decision after student and community request?
Yes, thank you. You know, it's never pleasant to see the school district in your community highlighted in the national media for incidents of racism. And I think York has been highlighted, I don't know, 5 times in the last 6 years or so, but it's not just happening in York, we know that. But the experience really was used as a spark for more engagement and activism around equity, which was a really good thing. You know, for a lot of young people, racism is something they unfortunately just have to live with, and they shouldn't have to. And they often don't have those coping skills to handle the stress that it creates. But when the leaders of the school default in their duty to protect the interests of all students, that adds even more stress. So students definitely felt discounted and unseen and not valued. And I recall at one of the school board meetings, a young woman spoke about her last 2 years of high school when she was called the terrorist by some of the boys in her class following a unit of study on 9/11. So for 2 years, because she was of Middle Eastern descent, she went through that. And even though she's now in college and she's doing really well academically, when she shared this with the school board, you could tell that she was reliving that experience by talking about it. That anxiety was right there below the surface. So if you multiply that times the number of students in the district who were hurt and confused and angry about the banning of materials, it's really huge. So there is something called adverse childhood experiences, or ACEs. A lot of you know about this. And it really talks about trauma that young people can experience at all ages. And when you add that impact of racism, you can see that it's severe and chronic trauma. And if you're familiar with the work of Bessel van der Kolk, he wrote a book called The Body Keeps the Score. So we know that trauma causes health issues. I'm a member of the Confronting Racism Coalition in York, which is a volunteer-led community action group. And I'm really pleased to say that due to their outreach, it would seem that the Central York School District Board is interested and willing to chart a course in a new direction. And I think recent school board elections highlight that the community is supporting them to do the right thing and demonstrate to students that they value diversity and are willing to find a collaborative path forward. So I am optimistic for now, Diane.
Thank you so much. Jean, to be honest with you, let's continue with you. And I'm going to change things just a little bit in the interest of time. I want to get to some of our questions. Instead of asking each one of you to give 2 action steps, I'm just going to ask for one, something that you're very passionate about, something that you think will be a powerful impact. Jean, will you get us started on the next steps, the strategic actions that we need to take regarding this particular topic?
But one thing that I would say, and I'm going to just put this out here for my white colleagues listening today, you are responsible for your own education. There are so many articles, research studies, TED Talks, really good TED Talk podcasts out there. So this work can be uncomfortable, but you have to accept that. There's going to be non-closure. You have to keep moving. You have to take that responsibility. And one thing that you will see announced in 2022 is YWCA of Greater Pittsburgh, Tri-County, York are partnering on an initiative to engage our communities in acts of racial healing. I think racial healing is something that we really need to be looking at. And we define this as the process in which we will acknowledge past wrongs, as well as acknowledging those lasting effects of trauma, but then begin to work together to create a better community and a better society. So stay tuned, there will be more information coming. We have the expertise of YWCA Lancaster to get us started in doing some training just this month with some of our staff. And I'm sure everybody attending is going to hear more about the Racial Healing Initiative.
Very good. Thank you, Jean. Let's popcorn over to Stacie Blake at the YWCA Lancaster. Stacie, one action step. What do we need to do next?
I can tell you one thing that we're working on here in Lancaster County, a coalition that includes the Chamber, the United Way, the Community Foundation, the CAP, the CDFI, Community Care, a private foundation, the City Alliance, are working with YWCA Lancaster to engage a professional analysis, a racial equity profile of our county, so that we will have the specific data about our county, similar to what Angela mentioned, for example, about Black women's rate of pay in Pittsburgh area. With this data and a narrative that confirms to us that this is the experience of our Black and Brown community here, we will have some clear policy next steps. This is a project that started about a year ago. We have a few months left, and I'm really excited because I know that sometimes decision makers speak different languages, and some respond to a story and some respond to the numbers. So we'll have both, and then we have a clear path and no more excuses.
Thank you, Stacie. Angela?
So for my one, I'll say use your platform to raise awareness and to amplify. And so recognizing that, you know, my basis, my background's in housing. And so that's I'm a statistician by training, but also in housing. And so one of the examples that I give when I'm giving talks is I actually show a picture of the house that I grew up in New Haven, Connecticut. My family was the first Black family to move onto that street, bought the house in 1968 after the Fair Housing Act, when it was no longer, you were no longer allowed to discriminate on the basis. Now, it didn't change behaviors of the neighbors. It was a hostile environment for my parents. They stayed. But why do I use my platform to raise awareness on that? Because one, it's still in many people's lifetimes. And two, recognizing that change in legislation also altered some housing patterns, but also recognizing it didn't alter mindsets. And so understanding coming in that you may not alter a person's mindset, but we can definitely alter practices and behaviors. So coming in, so using your platform to raise awareness. And then for the amplification, I understand that there are those who are coming at this at different levels, and someone might not be ready to write a letter to the county officials. You might not be ready to write a letter to your state or your federal legislators, but there are those of us who are doing it. So start to follow us and help to amplify the voices that we have out there that are trying to affect change. And then I noticed that information was put in. So you can join our pay equity campaign that we have here. You can join the Racial Healing Initiative. There are lots of efforts where you can actually plug in.
Thank you, Angela. Stacie, one last step, one strategic action. What would you share with us?
I think that a strategic action is to support the fair funding of Pennsylvania schools. I think education disparities are huge. And in Pennsylvania, there is a lot of effort and movement to really make the funding of Pennsylvania schools fair, and it will affect so many Black and Brown students across our state, across the Commonwealth, and it will begin to really chip away at that system of racism that is ever present in our school systems.
Thank you so much. Well, as I've alluded to several times during our time together this afternoon, we have some incredible questions from our audience. I'll start with the first one being the following. And this is open for any of the panelists to respond to. How do you suggest we engage with those who do not believe systematic racism exists? How do we change their minds? How do we engage with those who don't believe that systematic racism exists? Angela, I'll ask you to get us started.
I was trying to find my unmute button. And so coming back again, I can't guarantee you can change anybody's mind. So I want to start off there. So, but you can engage. And so I'll come at it from that perspective. One is recognizing, are you one who's willing to have a conversation and to listen to an altering viewpoint? For me, there's no debate that systemic racism still exists, but I'm willing to listen to others who believe that it does not. And from listening and finding out that perspective where someone else is coming, you actually can find opportunities to show and provide examples of how systemic racism is playing out today. So that when we see issues in terms of health disparity, when we, I'm one, my daughter's actually in here with me right now, that I'm one who was not heard at all in terms of my pain when I went in to deliver her, that I was completely dismissed at 40 years old, imagine that. So I know it still exists. I know that there are, and when we look at the resources that Stacey was talking about in terms of education, to me, there's no debate, but let me actually start to listen. And I mean, listen, that's not listening so that I can jump in, but, listen to see, what is your perspective, and then how can we come from there to at least a common understanding?
Thank you so much. Here's another very important question that comes from our audience. What can white allies do to help eliminate systematic racism? What can white allies do to help eliminate systematic racism? And we heard a little bit from Jean earlier about the importance of educating yourself, and Jean gave several examples of places and spaces that could help with our growth and development. May I hear from others about what our white allies could do?
So I really have one thing that I can say is move yourself from being an ally to an accomplice. And I think that's really important when you are a witness to something that is, so if there is a white person challenging the fact that systemic racism exists, and Angela is the one trying to convince that person or even listen to what that person is saying, sometimes you really need a white person needs to hear from a white person about what they've witnessed and what they've seen, and to help them understand the perspective. So I have a lot of friends, but I need people that are going to get into the fight with me, and sometimes even jump in front of me when you realize and recognize that racism and racist things are being said and done in a moment.
Thank you so much. Our next question from the audience: how do we handle conversations regarding CRT and racism? And this is from one of our audience members. How do we handle conversations regarding CRT and racism?
Diane, I'm happy to jump in here.
Sure.
And again, I want to direct this even more to the white folks on the call, because this is part of our work. And how do we handle CRT? With truth. CRT is not taught in any of our schools, and this is not a concern that we need to worry about. Another perspective on this is when we have Black parents concerned about what's being taught in our schools, that's when I'm going to want to pay a little more attention, because I already know that that is who is marginalized in our schools. And I really just want to encourage folks to have some courage here. What will I lose? Me. What will I lose if I speak out? What will I lose if the person who is perpetuating racist ideas and not believing in systemic racism, what will I lose if they disagree with me or don't want to be my friend? What will I really lose? But what does it cost if I do not stand up? That's the real question to me.
Thank you so much, Stacey.
Diane, if I can just jump in really quickly on this one, and coming
Absolutely.
into the area of education is also understanding when someone is talking about CRT or critical race theory, is that really what they're talking about? And so we've been learning that some people are saying it because they're hearing about it, but they don't really know what it is. And so several of our, I'm not telling people to wait till April, you can reach out to us now, but there are several of our YWCAs that will be participating in our National Stand Against Racism Challenge. And one of the potential topics is around critical race theory. And YWCA Greater Pittsburgh has also had an action conversation around that. And I'll see if I can put that into the chat.
Thank you so much. Very much appreciated. I think we have time for each one of our panelists to make some short closing remarks, concise, so that we'll have an opportunity for me to do some wrap up and also some thank you. So Stacey, we'll start with you. Anything that you'd like to, Stacey Woodland, I'm sorry. Anything you'd like to say that you didn't get to in the way of closure and wrap up, please?
Sure. I really want to say we need all ages and all stages of this work. And that, you know, the innovation that young people are going to bring is as relevant as what the adults are going to bring or what the historical context that seniors are going to bring. And as we really push through to get rid of and the systemic racism that is so prevalent, we need all ages at all stages.
Thank you so much, Stacey. Jean?
Sure. I think for me, the value that I've derived has been through conversation and through telling stories. We did a year of courageous conversations, and we started to see that ripple out across our community. And we really started to see some significant change because a lot of people are living in their own bubbles. And when they're pulled out of that comfort zone and they have an opportunity to connect, change really happens. Hearing from a young man who went to work at a York company where there was overt racism, and then he connected with a coworker on hunting, and now they're best of friends. Like if we can build those personal connections, I think we'll continue to see significant change.
Thank you so much, Jean. Stacie Blake.
You know, Diane, we know that most of the decision makers and people who hold power over some of these topics we've been talking about are white. And it can be hard to talk to them about this or to ask them to take action. But I'm going to tell you, it is harder to listen to Black women beg for their lives. And that is what we are hearing. We have to take this seriously and we have to make change.
Thank you, Stacey. Angela?
I'll end where I started, recognize the individual in the collective and the impact of the collective on the individual.
Thank you for that closure. I want to say this to my distinguished colleagues and as well as the audience. This was a powerful hour, powerful for me individually. I think that just reading and listening to some of the comments tells us a number of things. We've heard data. We've heard much more about the problem than perhaps we knew at the beginning of the hour. We've been encouraged to speak up and speak out. We've been encouraged to also take courageous action through a number of exploratory conversations. We've talked for the last several minutes about the crisis and how it divides the haves and the have-nots. But again, to borrow some of the phrases that I've heard from our panelists this afternoon, I would encourage the audience to think about the following. We've heard about acknowledgement, and I believe it was Stacie Blake that shared a quote from a great African-American leader about ripening the time and how important that is. And that's certainly part of acknowledgement. How do we go about ripening the time? We've heard about acceptance, and I just want to add to what Stacey Woodland talked about in terms of being in places and spaces where labor shortages are talked about and unskilled labor. But we also have to look at the attitude, because I'm in spaces and places where the attitude is they don't want to work. And so accepting the fact that through acceptance, it's important for us to look at attitudes. It's very important. Action. We've heard today a lot about access, about wealth creation, about fixing the system. And what I'm really left with in this particular area is the idea of how intentional and purposeful it's important for us to be. If you don't remember anything else about this hour, I think that it was very clear that this work must be done in a collaborative way, and it takes all of us. And so those words around, you know, we had a lot of A words here today about moving from being an ally to an accomplice is extremely important as well. I'd like to take this opportunity to thank our thought leaders here today: Stacie Blake, Stacey Woodland, Angela Reynolds, and Jean Treuthart. Thank you so much for all that you've done to make this hour such a complete conversation.
And thank you, Diane, for what you've done.
Absolutely. Thank you.
It's my pleasure. It is an honor to be in your presence. Want to also thank the YWCAs you represent, and the regions and the women and the people and the families and the children. Thank you so much to those sister institutions and organizations. And then finally, and most importantly, thank you to our audience that you would give an hour of your time on at least in this part of Pennsylvania, a cloudy afternoon to spend with us, giving your input, providing your insight, only allows me to know how important this fight is. And we can only do it with your help, cooperation, and obviously with your collaboration. Have a great afternoon. Look forward to a wonderful weekend. And thank you very much for joining us. Oh, and Jasmine, thank you so much for all the work that you've done on creating this hour.